Hello, namaste, everyone. Good afternoon. Uh, it is my pleasure to introduce Dr. Jeewan Pillai, a renowned cardiothoracic and vascular surgeon serving at Metro Hospitals and Heart Institute in Noida, Sector 12, UP. Today, we have, as we know, we are going to discuss about heart surgery. We have him with us. Dr. Pillai has over 15 years of extensive experience in adult cardiac surgery with a primary interest in CABG and valvular heart disease in adults. He is particularly known for his specialization in minimally invasive cardiac surgery, which includes minimal access valve replacement and coronary artery bypass. His well defined plans and procedures for critical care cases have enabled numerous patients to achieve a speedy recovery. Dr. Pillai is a compassionate doctor who is committed to keep himself updated with the latest innovations in the medical field. He has several publications under his name and is dedicated to provide the best possible care to heart patients. So I'll welcome Dr. Jeevan and thank you, sir. Thank you for joining us today.
Good afternoon, Dipesh. Good afternoon.
गुड आफ्टरनून सर सो विल स्टार्ट एंड हम इंग्लिश में बात करेंगे सर। तो पहला सवाल मेरा यही है कि सर सबसे पहले हम हार्ट सर्जरी की बात कर रहे हैं तो हार्ट सर्जरी की जरूरत पड़ती क्यों है सर?
इससे पहले कि मैं हार्ट सर्जरी के बारे में बताऊं, I would like to tell about a little bit about the history of heart surgery. देखें तो heart surgery is not very old. Its root, basically, the development of heart surgery took place during the Second World War. In the 1940s, a lot of work was done and a lot of progress was achieved as far as heart surgery is concerned. Subsequently, the second half of 20th century saw rapid strides with the Mason-Sones developing coronary angiography and subsequently Favallaro doing good work in coronary surgery, particularly with the advent of cardiopulmonary bypass, the Gibbon machine, and it was at Mayo Clinic that the initial thrust to cardiac surgery was given. And by the way, I was also at Mayo Clinic. So it is considered to be the mecca of cardiac surgery. That is where actually the real thrust took place. In the 1990s, there was a significant development, significant change took place, and beating heart surgery came into picture. So if we see the beating heart has a history of around 30 years, 35 years. And per se, coronary surgery has a history of around 30, 50 years or so. So all these developments have taken place over a period of 50 years. Now we are also at a very significant moment of cardiac history, where we have started doing minimally invasive, whether it be coronary surgery, whether it be valvular surgery, and it is very, very interesting times. What used to be a 11-inch incision and has now been reduced to around 3 to 3.5-inch incision.
Thank you, sir. So question my first question is सर कोरोनी ये जो बाईपास सर्जरी होती है सर ये काम कैसे करती है? क्योंकि ये जैसा आपने बताया सर कि पहले बलूनिंग होती थी एंड एंजियोप्लास्टी होती है, तो ये उससे कैसे अलग है? क्यों हम इसको करते हैं सर?
So actually, here we have to understand that the heart has muscles. Muscles are supplied by coronary. The blood supply to the myocardium is through coronaries. If there are blockages, suppose there are simple blockages, very discrete blockages of 1, 2, oblique 3 arteries, it is very conveniently dealt with by angioplasty. However, if it is a complex lesion which is very long, it is calcified, the calcium score is high. It is at a very at a location where angioplasty is a little difficult. or the result may not be very good, that is the time when bypass comes into the picture. So bypass is basically we are making alternate route for coronary supply. So once the blood supply is restored, the muscle of the heart can work properly and heart function can be preserved.
Thank you, sir. Uh, so we talked about beating heart surgery. So what exactly it is?
So, like I told you, in the 1960s and 70s, coronary bypass used to be done with the heart put on bypass machine and the heart arrested. So we used to very delicately dissect the coronary arteries and do the bypass. Subsequently, in 1990s, that concept came where we worked on the heart, which is continuously beating, and we just immobilize a small segment of the myocardium, and we make the bypass there. So essentially, what we are doing is we are trying to exclude the negative effects of bypass machine. So we are getting the advantages of coronary bypass surgery without the disadvantages of bypass machine, putting the patient on bypass machine. So that is by beating heart. Today, as of now, 90s, 99, 98, 99% of our cases are beating heart surgery.
Okay, sir. Thank you. My next question was, are all CABG beating heart surgeries? I mean, are all
Yeah.
CABG surgeries are beating heart? But I guess you
So
have already
like
answered that.
I would elaborate on that. Essentially, almost 80, 98 to 99% of the surgeries are safely done in beating heart. However, there are certain indications when we note that the heart is not working very well, or it may create problems, or there is a sudden deterioration in the hemodynamics. Uh, that is, or where the location of the coronary is such that beating heart may not give very good anastomotic results. That is the time when we actually put the patient electively on bypass and do the coronary artery bypass grafting.
Okay, okay, sir. Uh, Now I want to know more about minimally invasive cardiac surgery. We now hear more about this. You have recently done few cases which were very exceptional, and we want to know how it is different from your regular CABG and beating heart surgery.
See, I think one of the major uh, misconception, or rather, the going in for angioplasty vis-a-vis surgery, one of the major reasons was the incision and cutting of the bone. So it used to be very difficult to convince a person, convince him about the advantages of coronary bypass surgery. So over the past 5 years, 6 years, we started doing small incision coronary surgery. So that way, we are better able to convince people. We show them the photos, and we are able to convince them that we'll be giving you 3-inch incision, 3.5-inch incision. We'll not be cutting the breastbone, and the post-operative pain will be less. The requirement of blood is less. Uh, the person is able to go back to work in 5-6 days. Uh, so there are huge advantages, but of course we have a very strict selection criteria for minimal invasive, and as we go about doing more and more of these, I think these we will try to relax these criteria, and we'll try to include as many people as possible. We'll try to make them candidates for small incision coronary surgery.
Okay, sir. Thank you, sir. Uh, Also want to know, in comparison to other surgeries like beating heart surgeries, what all risks are involved in minimal invasive surgery?
Uh, I don't think so. There is any additional risk, but the only thing is, like in minimal access coronary surgery, we are using only one lung for oxygenation purpose. So pre-operatively, we ensure that the person will be able to sustain on one lung throughout the duration of the surgery. The other thing is we should not be having any adhesions in lung. If there are adhesions, then the access to heart becomes very, very difficult. Third is if the person is very, very heavy, if the BMI is above 25, close to 30, it becomes very difficult to do minimal access. And if there are thoracovertebral deformities, um, severe COPD, emphysema. I think these are the main contraindications. Off late, we have not been doing ejection fractions less than 30 for minimal access. So, I mean, broadly, these are the contraindications for minimal access.
Okay, sir. Uh, so we have been hearing about hybrid bypass surgery. So what exactly it is?
Hybrid is a concept whereby we try to get the advantages of angioplasty and the advantages of bypass. Like if you see the patency rate of Lima to LED is exceptional. So what we do is we give the benefit of the Lima grafting to the patient, Lima to LED, and we can put we can ask the cardiologist to do angioplasty of let's say OM and RC. So that is a hybrid procedure whereby we are trying to do a mix and match of angioplasty and bypass. So and with the advent of robotic surgery, again this concept of hybrid has come up in a big way, because if you combine robotic Lima to LED and you do a stent to LCX and RCA, I think you can the person will be very happy with a very small incision, and he gets the advantage of Lima to LED, which can last for 15 years, 20 years, and he doesn't have to undergo a massive coronary bypass surgery.
Okay, sir. Sir, I have a question. All all patients who are eligible for any sort of heart surgery, be it beating or CABG or minimal. So, is there a choice? A patient can go for minimal invasive, or there is no choice.
Like Dipesh, I told you, there is a strict, as of now, we have a very strict selection and exclusion criteria. Selection criteria is basically he should be of decent build. The CT ratio should be optimal. The heart should be small. The heart function should be good. The lung function should be very good, so that we are able to sustain on one lung for coronary bypass. There should not be any lung adhesions. We try to evaluate the lung pre-operatively and see if the pleura is moving freely, and we don't expect any adhesions in the axis. The person uh, the complex anatomy and all that is avoided, as long as it is normal anatomy. BMI is good, heart function is good, CT ratio is good. The person is eligible for small incision.
Okay, sir. So, we are getting questions from audience. The first question is, will I be on medications after the surgery? And if so, for how long?
Yeah, this is for coronary bypass surgery, CABG.
Yes, sir. Yes, sir.
Yeah, it actually it all depends upon the condition of your heart and your comorbidities. Suppose your heart function is poor. If your heart function is poor, we will need to support the heart for an extended period of time. So medicines will be there to support the heart. Number one. Number two, blood thinners will continue for the rest of your life. There will be lipid lowering drugs that will continue throughout your life. If you have diabetes, if you have blood pressure, if you have thyroid, if you have any other comorbidities, that will be taken care of. So all those medicines will continue.
Okay, sir. Another question. How quickly will I recover through minimally invasive procedure?
Yeah. See, we generally extubate the patient after invasive surgery. We extubate the patient on the same day itself. We try to take the patient up in the morning. We complete the procedure by around 1 or 2. By evening, the patient is extubated. Next day, he started taking his own meals and all that, and he is off his bed. Day one. So in another third day or so, he can be discharged, and he can be back to work in another, I think, seventh, eighth day or so. He can be back to his work. This is the general. I will not be able to say for all, but yeah, this is the general recovery.
Thank you, sir. One last question from my side. At Metro Hospital, Noida, what all facilities we have for minimal invasive cardiac surgery, and are we doing these surgeries normally, and all those things?
Yeah. So we have been working on this for now 2.5 years or so. Uh, we have done practically every surgery, coronary bypass, all the valve surgeries. Now people are coming for follow up. We have a huge collection of it. More than 150 people have undergone small incision valvular heart surgeries and coronary bypass surgeries. And in constant touch with us in our OPDs. So yeah, because our program had a little bit of roadblock because there was some recommendation that we reduce the operative time as far as possible because of COVID, chances of people getting COVID. That was the time when we had gone back a little and stopped doing a little bit of minimal access. But then again, once this came down, we have again started doing. Today also we have done. Tomorrow also we are doing a small incision. So now it's become more of a routine rather than exception.
Okay, sir. That was it. And thank you, sir, for your time. I would request you to give us one last take home message, especially for those people who are little concerned about their heart health and how they can improve on that part.
Like I always tell my patients, post-operative patients, get back to work as quickly as possible. Get back to work. Try to have a regular regime. Try to have regular walking sessions, either in the morning or in the evening, whichever time is convenient for you. Have a very regulated diet. Whatever is made at home that you can use, but try to avoid too much of saturated fats. Uh, Too much of outside food has to be avoided. Uh, uh, Sugar has to be very, very carefully checked. HbA1c should be close to 6. Cholesterol every 2 years should see, and if it is deranged, you must get it back to normal levels. Thyroid levels should be good. So, as long as you take care of all these and remain away from smoking, have a very regular exercise, I think if you do all that, we'll be able to, your coronary bypass will be able to serve you for very, very long durations.
Thank you, sir. It was a really nice session where we came to know about so many things about heart surgery. And we'll be wrapping this up. And for those who have missed on the uh, part of this Facebook Live, they can still post their questions on the comment section, and we will revert by discussing it with Dr. Jeevan. Thank you, sir. Thank you, everyone, for
Chal-
joining us.
Thank you,
And
Dipesh. Thank you.
thank you, sir.